Hello, my name is Lyubov Minyalenko. I work at the Department of General Practice Family Medicine of Zaporozhye State Medical University. Our today's topic is the prophylactic medical checkup, rehabilitation, and resort treatment. Preventive medicine consists of measures taken for disease prevention as opposed to disease treatment. Just as health encompasses a variety of physical and mental states, so do disease and disability, which are affected by environmental factors, genetic predisposition, disease agents, and lifestyle choices. Health, disease, and disability are dynamic processes which begin before individuals realize they are affected. There are, depending on the state of health or risk factors or significant pathology, there are three types of prevention: primary, secondary, and tertiary. Primary prevention include methods to avoid occurrence of the disease: vaccination, rational work and rest, good nutrition, physical activity, the environment. Most population-based health promotion efforts are of this type. For example, education about good nutrition, the importance of regular exercise, and the dangers of tobacco, alcohol, and other drugs. Education and legislation about proper seatbelt and helmet use, regular exams and screening tests to monitor risk factors for illness, immunization against infectious diseases, controlling potential hazards at home and in the workplace. Secondary prevention include methods to diagnose and treat existing disease in early stages before it causes significant morbidity. Complex of measures aimed at significant risk factors, which under certain conditions can lead to the emergence, exacerbation, or relapse. The most effective means is a preventive medical examination as a method of early detection of disease and treatment. For example, telling people to take daily low-dose aspirin to prevent a first or second heart attack or stroke, recommending regular exams and screening tests in people with the known risk factors for illness, providing suitably modified work for injured workers. Tertiary prevention include methods to reduce negative impact of existing disease by restoring function and reducing disease-related complications. Set of measures for the rehabilitation of patients. Tertiary prevention is aimed at social, labor, psychological, and medical functional recovery of organs and body systems rehabilitation. For example, cardiac or stroke rehabilitation programs, chronic pain management programs, patient support groups. Each year, millions of people die of preventable deaths. Leading causes included cardiovascular disease, chronic respiratory disease, unit tension, injuries, diabetes, and certain infectious diseases. A lot of people die each year due to poor diet and a sedentary lifestyle. According to estimates made by the World Health Organization, about 55 million of people died worldwide in 2011, two-thirds of this group from non-communicable diseases, including cancer, diabetes, and chronic cardiovascular and lung diseases. Preventive health care is especially important given the worldwide rise in the prevalence of chronic diseases and deaths from these diseases. It is recommended that adults and children aim to visit their doctor for regular checkups, even if they feel healthy, to perform disease screening, identify risk factors of disease, discuss tips for a healthy and balanced lifestyle, stay up to date with the immunizations and boosters, and maintain a good relationship with the healthcare provider. Some common disease screenings include checking for hypertension, hyperglycemia, hypercholesterolemia, screening for a colon cancer, depression, HIV, and other common types of sexually transmitted disease such as chlamydia, syphilis, and gonorrhea, mammography, colorectal cancer screening, a pap test to check for a cervical cancer, and screening for osteoporosis. Genetic testing can also be performed to screening for mutations that cause genetic disorders or predisposition to certain diseases, such as breast or ovarian cancer. The general medical examination is a common form of a preventive medicine involving visit to a general practitioner by well-feeling adults on a regular basis. This is generally yearly or less frequently. The general medical examination generally involves a medical history, a brief or complete physical examination, and sometimes a laboratory tests. Some more advanced tests include ultrasound and mammography. If necessary, the patient may be sent to a medical specialist for further and more detailed examinations. People who undergo yearly medical exams, however, are more likely to be diagnosed with medical problems. It is recommended cancer-related health checkups annually in men and women older than 40 and every 3 years for those older than 20. The examination does result in better delivery of some other screening interventions, such as pap smears, cholesterol screening, and fecal occult blood tests, and less patient worry. The general public is fond of these examinations, especially when they are free of charge. Despite the guidelines recommending against routine annual examination, many family physicians perform them. A fee-for-service healthcare system has been suggested to promote this practice. An alternative would be to tailor the screening interval to the age, sex, medical conditions, and risk factors of each patient. This means choosing between wide varieties of tests. Rehabilitation, or just rehab, is a process of care aimed at restoring or maximizing physical, mental, and social functioning. Can be used for acute reversible insults, for example sepsis, acute non-reversible or partially reversible insults, amputation, myocardial infarction, and chronic or progressive condition like Parkinson's disease. Rehabilitation contains a selection of non-evidence-based, common-sense interventions, comprising positive attitude. Good rehabilitationists are optimists. This is partly because they believe all should be given a chance, and partly because they have seen very trial and disabled patients do well. A positive attitude from the team and the other rehabilitation patients also improves the patient's expectations. Rehabilitation wards should harbor an enabling culture where the whole team encourages independence, patients dressed in their own clothes with no catheter bags or shown on eating meals at the table with other patients. MDT coordinated working. By sharing goals, the team can ensure all team members are consistent in their approach. Functionally based treatment. Example, the hemoglobin level only matters if it is making the patient breathless while walking to the toilet. Individualized, holistic outcome goals. This incorporates social aspects which are often neglected. The team concentrates on handicap rather than impairments. Impairment is a pathological defect in an organ or tissue. For example, homonymous hemophonemia due to posterior circulation stroke. Disability is a restriction of function due to impairment, for example, inability to drive due to visual defect. Handicap is the social disadvantage caused by disability, for example, unable to visit friends in neighboring village as unable to drive. It can be seen that some impairments produce no disability or handicaps, and some handicaps are due to multiple interaction impairments. The system allows the social circumstances to be fractured in such as in the example given, the disability produces no handicap if a regular bus route exists. Doctors are generally focused on impairments, poor and assessing disability, and rarely consider handicap. Despite the attractive logic of such a classification, it is actually rarely used in clinical practice. The WHO issued a new classification of functioning disability and health in 1999, which is a little more complex, but has a broadly similar structure. You can check it on this website shown. Specialized rehabilitation wards are not the only place for rehab. If the considerations outlined are in the place, then successful rehabilitation can take place in acute wards, specialty wards like stroke units, orthopedic wards, and so on, community hospitals, day hospitals, nursing and residential homes, and even in the patient's own home. These alternative sites often employ a roving rehabilitation team which may be based in a hospital or the community. The process of rehabilitation includes 7 steps. First is selection of patients. Most hospitals do not have enough rehabilitation beds to cater for all patients who could benefit, so these beds are a valuable resource. This is often not understood by the patient, relatives, or reference service. Patient selection is a time-consuming, important, and complex task. Where there is no cost limit, the approach can be more inclusive. Even patients with no recovery potential can benefit from aspects of the team's expertise, learning adaptation, teaching skills through care, or arranging complex discharge packages. The second step is initial assessment. It is not like a medical clerking. You need to get to know your patient on different levels, their mood, motivation, expectations, and the complex of social factors. Remember, it is more meaningful to assess the handicap, not just the impairment. Third step, goal setting. Aims and objectives of rehabilitation. It is essential that the MDT, ideally in conjunction with the patient, states what it plans to do and to achieve, in clear terms that are shared within the team and can be worked towards. A large part of this is achieved through the agreement and statement of targeting as to hierarchical levels, aims and objectives. Aims, best set by the team in discussion with the patient. 1 or 2 patient-centered targets that encompass the broad thrust of the team's work. A team mission statement for the individual. For example, to achieve discharge home with the support of the spouse at 6 weeks, or to transfer easily with the assistance of one, thus allowing return to existing residential home place at 4 weeks. Objectives. Best set by individual team members, in discussion with the patient. More focused targets, usually several, that reflect specific disability and help focus the team's specific interventions. For example, to walk 10 minutes independently with a single stick at 3 weeks, to achieve nighttime urinary continence at 4 weeks. Both aims and objectives should have 5 characteristics summarized by the acronym SMART. S for specific, focused, unambiguous. M for manageable, amenable to the team's influence. A for achievable. R for realistic, acknowledging time or resource limitations. And T for time-bounded. Fourth step of process of rehabilitation is therapy. Medical, doctor-led. Doctors are commonly part of hospital rehabilitation teams but may be missing from a community rehabilitation teams, where nominated doctor, for example, general practitioner, can be consulted about specific issues. When present, doctors often chair MDT meetings. This may be partly historical and partly because they are professional risk takers who are more confident and coaxing a shared decision from a team, sometimes in very uncertain circumstances. Fifth step is reassessment, usually weekly MDT meetings. Goals are adjusted and new goals are set. Endpoints of this program, 3, 4, and 5th steps are repeated in a cycle until the patient is ready for a discharge. So the 6th step is discharge. Planning should be started as soon as the patient is admitted, by the efforts escalate toward the end of the inpatient period. A home visit and family meetings are often held to clarify issues. And 7th step is a follow-up and maintenance. Post-discharge outpatients attendance, ideally done by the same team, but in reality thus function often taken over by community, in which case good communication is vital. When we're talking about sanatorium treatment, we should know this is a medical care which is carried out with a preventive medical or rehabilitation purpose using natural health factors in the condition of stay in a resort or a health improving area in sanatorium and resort facilities. Depending on the age of patients who are shown sanatorium and spa treatment, there are following sanatorium and spa establishments: adult, children, and both parents with children. The main tasks of the sanatorium resort treatment are elimination or reduction of manifestation of the pathological process, stimulation of regeneration and restitution, restoration or improvement of broken functions, increase of general reactivity, training of adaptation mechanisms, consolidation of the results of treatment that was achieved at the previous inpatient or outpatient clinic stage, prevention of disability, promotion of social rehabilitation. But you still should remember there are contraindications for sanatorium and resort treatments, and there are all diseases in the acute stage, chronic diseases in the stage of exacerbation, diseases of the internal organs in the presence of severe organ failure, infectious and parasitic diseases, mental illness, addiction, alcoholism, malignant tumors, cachexia of any region, systemic blood diseases, frequent recurrence of abundant bleeding, pregnancy at all times for balneological and month resorts, and for climatic resorts, pregnancy starting from 26 weeks, all sexually transmitted diseases, and all forms of tuberculosis in the acute phase. Climatotherapy is called the use of meteorological factors, the features of climatic and weather conditions of the area for therapeutic and prophylactic purposes. There are a lot of climate elements: barometric pressure, air temperature, humidity of air, the wind, cloudiness, rainfall in months, solar radiation, the chemical composition of the air, atmospheric electricity, ionization of air, features of the soil, vegetation and snow cover, the presence of water basins, altitude, geographic location of the terrain, radioactivity of the soil. There are a lot of types of climatotherapy, but the most common of them are aerotherapy, heliotherapy, thalassotherapy, and speleotherapy. Aerotherapy uses the exposure to open, fresh air for therapeutic and prophylactic purposes. Heliotherapy can use the sun beams for their therapeutic and prophylactic purposes. Thalassotherapy is the use with therapeutic and hardening purposes of climatic, balneological, hydrotherapeutic factors associated with the presence of the sea, and speleotherapy, the effect on the patient microclimate of crust caves and salt mines. Balneological resort. Balneotherapy is a set of therapeutic methods based on the use of mineral waters. Therapeutic mineral waters, varieties of groundwater which are suitable for therapeutic use due to the content of dissolved gases, total mineralization, and the presence of active ions. Mineral water contain different salts in the ionized form. Depending on the prevailing anion in the water, there are hydrocarbonate, chloride, sulfide, nitrite, and water of a complex composition. The main cautions are sodium, potassium, calcium, and magnesium. The gas composition is distinguished by the water of carbon dioxide, hydrogen sulfide, radon, and nitrogen. Depending on the content of the trace elements, iodine, bromine, glandular, silicose, arsenic. Thank you very much for your attention.